You're listening to This Week in America with Rick Bratton.
Welcome back, everybody. This Week in America, website thisweekinamerica.us. Our guest on the program, Dr. Allan Hedberg, is a clinical psychologist, maintains a private practice in Fresno, California, received his doctorate from Queen's University in Canada. He's published over 75 papers, presented many professional seminars on various topics like addiction problems, marriage and family enrichment, the aging brain, depression, and leadership. He's the author of 7 books. He's working on his 8th. The book we're going to be talking about today is Achieving and Living a Healthy Lifestyle in a World of Stress, 70 Lessons for Those Wanting Improved Health and Lower Healthcare Costs. And I think we all fall into that category. Dr. Hedberg, welcome to the program. Great to have you with us.
Thank you, and nice to be with you. And this is a great topic, especially in the day and age which we're living. Well, stress is at a high level, and we need some strategies to deal with it.
Have you ever seen a higher level in the times that you've been actually seeing people? I mean, everything is now instant gratification, short attention span. Have you ever seen a time when we've been dealing with more stress?
Not really. I've been in practice as a clinical psychologist and seen families for 45 years. And obviously, stress has always been part of family life. It's part of an individual's life. It's part of our society. But, we have issues today which are not only different, but they raise us to a higher level of stress. And we don't have the skills, or most people don't have the skills to deal with them. That's why I wrote the book.
Well, and the book is an excellent one. It's available all across the country, information at our website, thisweekinamerica.us, and at Dr. Hedberg's website as well, which is author Allan Hedberg, and that's Allan with 2 A's, .com, author AllanHedberg.com. If you go to thisweekinamerica.us, you can link on directly with the website and get information on the book. The book is Achieving and Living a Healthy Lifestyle in a World of Stress. What's interesting is, at least it seems to me, that a lot of the factors that create the stress are factors designed to maybe make life a little bit better, a little bit easier. We can communicate more quickly, that type of thing. Do you find all the modern technology, at least for some of us, is actually a source of stress?
Well, it is, especially for the older population. The older you are, the harder it is for you to learn something new.
Yes.
And in particular in the area of technology, that's a whole different world and a whole different set of skills that older people do not have, but are required to acquire them. And that's a stressful event in itself. So for the older people, the technology is a stressful event. For younger people, it's a piece of cake. They enjoy it. It's fun. It's relaxing, but it's a way to avoid. It's a way to exclude yourself. It's a way to hide. It's a way to remove yourself from society. And that's the problem that it creates. So a stress on one hand creates another kind of stress. And for children, I think we're looking at a stress problem in the future that's going to be even greater than we see now, because they're learning to avoid, they're learning to escape, they're learning to be by themselves, and they're learning to use technology, not deal with people, not interact with people, not communicate, not be assertive, and work out problems and make decisions together in a group situation. More isolationism. And that's going to create another layer of stress, particularly for young kids coming through now.
Well, I was going to ask about communication. Do you see this with the younger people, that slowly those communication skills are eroding because we really don't communicate verbally anymore?
Exactly. We don't communicate. We don't communicate in groups. We don't have group discussions very much. We don't make decisions together. We don't work as a team. There's a lot of individualism. And that's, of course, what technology is designed to facilitate, but it also creates that kind of a problem. And when kids can't communicate, they're going to then have difficulties that they won't work out. They won't learn how to solve problems. They'll have problems, but if you know how to solve them, it's not so bad. But if you have a problem and don't know how to solve it, don't know how to assert, don't know how to make decisions together, don't know how to confront people, don't know how to get facts and work with them, then the problems go on and on and on, and they become chronic.
You're listening to This Week in America, website thisweekinamerica.us, where you will find information on our guest on the program today. Our guest is Dr. Allan Hedberg, and Allan is spelled with 2 A's. His website is author AllanHedberg.com. The book we're talking about, and he's got plenty, and this one on the program today, we're talking about the book, Achieving and Living a Healthy Lifestyle in a World of Stress. It's interesting, the 2 sources of inspiration you had to write this book, and the first being self-help and something you really believe strongly in. Talk a little bit about that and the source of inspiration for the book, Achieving and Living a Healthy Lifestyle.
You know, I have a clinical practice, and I see many people with health problems. It's one of the areas of specialty that I have in my practice of various kinds, like sugar diabetes and people who've undergone strokes and older people that are in dementia and Alzheimer's and a variety of different kind of health problems. And when you deal with people with health problems, you want to be as helpful as you can. So what I've done over the years, I've written small little papers on different topics to give to people. And when I've given an address somewhere, I'll hand those things out. And people seem to appreciate a little bit of a handout of some kind that just tells them how to deal with a particular problem, in this case, a health problem. So what I did is I took those and kind of put them together and kind of created a book, obviously. And so the inspiration came from my own patients who come to me with a health problem and say, okay, how can I live with it? How can I cope with it? How can I manage it? And how can I reduce the pain or reduce the stress that health problem creates for me? I may not be able to solve the health problem, because that may be a medical problem.
Right.
But I can help them cope with it and live with it and manage it. And then problems become less.
Well, one inspiration, a lady you treated, her name was Molly, 98.6 years old, an amazing story. And here really is someone who did look out for her own health and lived to be almost 99 years old.
Never went to a physician, never took medication. But she walked, she ate her fruit, she ate her vegetables, she interacted, she had a social network, she had a close family, she had good sleeping patterns, she had a good social network, and be able to put those all together gives you longevity, number one, but also gives you a healthy lifestyle.
You're listening to This Week in America. Our guest on the program is Dr. Allan Hedberg. His book is called Achieving and Living a Healthy Lifestyle in a World of Stress. His website is authorallanhedberg.com. You can link on directly to our website, thisweekinamerica.us, and go directly to the doctor's website. In the book you talk about, and this is so important, it's something maybe we rush into, or we take a recommendation from a friend, or we go online and we get a recommendation, what to look for in finding a physician or a therapist. And you've got 6, and they really are vital if you're looking for a physician or therapist. Let's start with number 1 that you have in the book. You need to find someone who's a listener. And this is so important because oftentimes you're not even sure the physician, the doctor's even listening to what your conversation is.
It's an interesting point because we want to talk. We want to tell our story. We want to expose our pain or our suffering or our area of difficulty. And we want somebody to listen. We want a listening ear. Because some of the healing itself takes place in that interactional pattern between you and a professional, whether it be a physician or whether it be a psychologist or whomever. So that's part of the healing process. So you have to have a professional that listens, that will put his pen down, put his computer aside, and just look at you and just interact with you in a listening, interactive kind of way. What we find now is that physicians have a computer in the room. They ask you questions, you answer, and they answer onto the computer and don't look at you. And patients hate that. Patients are very distressed over these doctors who they're concerned about pressing the button and filling in the blanks of a computer. And I know why they do that. Insurance companies have them do that and so on. But it takes away from the doctor-patient relationship, and it minimizes the healing component of interaction.
It's interesting you point out as well, we're obviously talking in listening the verbal aspect of it, but you also talk about nonverbal is very important too. When you have someone in the room, are you watching like body language, that type of thing?
Sure. You can tell when somebody's listening to you attentively and interactively. You can tell that. Or if they're just kind of passively sitting there letting you go on, but are not communicating, not connecting, with you. And that's what those body language signs indicate, whether you are connecting with the person or not. Eye contact, gestures, moving forward, leaning forward, kind of feeling your pain, so to speak. That's what you want in a physician. That's what you want in a therapist.
Another a quality you look for is readiness, a knowledge of resources. And obviously you need someone, I'm sure in your field things change practically even a daily, weekly basis where you really need to be studying and have those resources available.
Every profession is like that. There's such a knowledge base which is so large that nobody can be comprehensively understanding everything. So we all have our own limitations, but you want a doctor who reads. You want a doctor who studies. You want a doctor who reads the research, who looks into the research and does research even, because that says that here's a person who's keeping up. Here's a person who's trying to stay current. Here's a person who's trying to meet your needs by seeing what else is being done in the medical community or the psychological community at the time that could be of help to you. So when you have a doctor that is on his toes, he's reading, he's interacting, he's going to meetings, he's going to conferences, he's doing research, you know you have a man that's at least as knowledgeable and on top of the game as possible.
Our guest on the program is Dr. Allan Hedberg. The book is Achieving and Living a Healthy Lifestyle in a World of Stress. His website is authorallanhedberg.com. Allan is with 2 A's. Our website, thisweekinamerica.us, will provide a direct link to that website. We're talking about what to look for in a physician or therapist. And this is so important. You're talking about the capacity of the physician or therapist for insightful compassion and understanding. It's so difficult when you find somebody with a tinge of judgmentalism as they're talking with you. You really need to find somebody who understands you.
You want understanding. You want somebody who has some empathy.
Right.
You want somebody that is not necessarily sympathetic, but empathetic. Empathetic means that you understand, that there's a connection, that there's a feeling level between the two of you, and there's caring, there's compassion. That's what empathy kind of represents. And you need a professional who represents that form of empathy, so that when you go, you know you're going to be received. When you go to an appointment, you know that you're going to be heard. You know that you're going to be listened to. You know that your statements and your concerns are going to be taken seriously and considered and responded to, as compared to just going through an appointment in 3 minutes or 7 minutes or whatever it might be with many physicians.
You say another quality to look for is attitude and humility of a servant. And that I had an eye surgeon once, and he thought he was a rock star. I mean, there was no relationship there whatsoever. We were just on different wavelengths. And when you have a doctor who possesses that, the humility, and sort of puts him at your level to guide you through, as a patient, you feel a whole lot more comfortable.
Yeah, when you have that, you're working in like a peer. You're working like a team.
A team,
the two of you are
exactly,
working together. Yes. You have a teamwork. That's healing. Healing is partly the relationship that you enter into, as it can be the stress of your life as well. But in a medical sense, you want to see the healing process, and you have to have a doctor that has some humility, that has some ability to just relate to you at your level and understand you at your level, and not trying to impress you with his or her credentials.
You look for self-care, and you talk about that. I'm sure you talk about that.
Yes.
You talk about that a lot in the book, Achieving and Living a Healthy Lifestyle in a World of Stress, 70 Lessons for Those Wanting Improved Health and Lower Healthcare Costs. You mentioned that in the book, self-help care. Exactly what is that? In fact, you talk about if we really don't do that ourselves, it brings more stress into our lives. We actually can limit some of the stress by trying to take care of ourselves.
I had a talk with a physician recently, and he was asking me what my pattern of exercise is and how I take care of myself. And I gave him my answers of how I swim and do other kind of things. And then he related to me a couple of things that he did. And that was good, because that gave me a sense that he's taking care of himself. And when he asked me to take care of myself, I know that he speaks with some authority. I know that he speaks with some concern and some personal concern. He's stepping over a barrier from that professionalism out there to a colleague interactional pattern with me, because now we can both talk about what we do to improve ourselves and keep ourselves healthy. And that's a motivating factor. If I know that he's doing something to keep himself healthy, that motivates me to even do more to keep myself healthy. That's why self-help is important.
A couple of minutes left in the program, going way too quickly. The book is Achieving and Living a Healthy Lifestyle in a World of Stress. In the book, one of the chapters, and it's very enlightening, is the chapter is entitled, What Causes Poor Health? And we tend to think we're just sort of victims of everything around us, genetics, the environment, that type of thing. And you really bring home the fact that we really create a lot of the poor health problems ourselves by the choices we make.
Well, we do make choices, and we make some pretty awful choices. I'm sure
Yes,
at times.
we've all done that.
And we make some good choices. We know how to eat. We know that vegetables and fruits are important to maintain a good health pattern. It stimulates the brain, makes the brain stronger, makes the brain function better. So what you do for your brain, you do for your body. And what you do for your brain and from exercise, what food you eat, how you stimulate it through education, through intellectual activity, you're doing something for your whole body. And that's the kind of the choice you have to make. You have to think in terms of, am I doing this just to strengthen my muscles, to look better? Or am I doing this to make my brain function better? Because when my brain functions better, I'll be healthier. So health is important when we think of it in the sense of making sure we have a strong brain, that it's fed well with good food, good exercise, good intellectual stimulation, good social interactions, and from that will stem better health.
The book is called Achieving and Living a Healthy Lifestyle in a World of Stress, 70 Lessons for Those Wanting Improved Health and Lower Healthcare Costs. Guest on the program this week in America is Dr. Allan Hedberg. His website is authoralanhedberg.com. By going to our website, thisweekinamerica.us, you can link up directly with the doctor's website. Again, the book, Achieving and Living a Healthy Lifestyle in a World of Stress. I'm going to take a minute or so here at the end of the program and talk about other causes of stress. And you talk about divorce. It's something that millions of Americans go through. I think about half the marriages end up in divorce. And you talk about what a stress, and this again is something when your patients come to you, it's not something you're not a marriage counselor, you can't put the marriage back together, but you can help them deal with the stress. How stressful is the whole act of going through a breakup, of going through a divorce?
On a 10-point scale, it's 8. It's a very, very high level. And there's a lot of things that happen in divorce. A dream is broken. A plan, a goal is no longer achievable. Relationships that are important, intimacies which are important, are now no longer possible. We lose a lot in divorce, and that's why depression results from divorce actions, and when marriages have the stress and then break up, because it's what we lose. It's not the divorce per se, but it's what we lose in that relationship and what we lose when a divorce happens. And you have to think in terms of what you committed to in a marriage, those are gone. And it's particular to that area of a goal, of a plan, of what you had hoped for, what you had been achieving, what you had already achieved up to that point in time. Now all those things are going to be gone.
Tell me about the link between mental issues such as depression or just dealing with stress and poor health and illness.
Well, stress is, if you stay away from people, you tend to become more depressed because isolation leads to depression.
Right.
It keeps you away from interaction. It keeps you away from positive experiences, joyful experiences, positive people. The more that you have stress and isolate, so it isn't stress as such, it's how we deal with it, it's how we handle it. And when you isolate, you create a sense of depression, and then that creates a whole nother set of problems for you. So stress really should be a motivator to get you to talk to people, to consult people, whether they be professionals or they be friends or they be family, but be interactive so that you're getting answers, you're getting help, you're getting encouragement, you're getting strength, you're getting some positive input that you can work with to solve that area of stress or at least minimize it.
So if your normal inclination is maybe to withdraw, that's probably the worst thing you can do in that case.
Worst thing we can do. You know, it's that old fight or flight kind of
right.
idea. When stress comes on, and if you flee into isolationism and into avoidance, you're going to just create a greater problem for yourself and then add on things like depression. So the problem won't be solved. It's going to be lingering. It's going to go on for weeks, months, maybe years when you withdraw like that. The best thing you can do is get out and find somebody that you can talk to. Find somebody you can relate to. Find somebody who will listen, somebody who will empathize. Somebody will have a few ideas for you to kind of work on and try. And most importantly, go see a professional. Find somebody who's skilled in this area of handling stress, handling divorce, handling difficult circumstances that come into your life, and spend some hours together. It'll be a beneficial activity.
All and more in the book, Achieving and Living a Healthy Lifestyle in a World of Stress, 70 lessons for those wanting improved health and lower healthcare costs. Our guest on the program has been Dr. Allan Hedberg. I mentioned that he's written 7 books, working on his 8th book. One of the books is Doctor, Teach Me to Parent, and he's got some top 10 parenting tips in that book. The doctor will be back soon on the program, and we will talk about that book, Doctor, Teach Me to Parent, something we're all talking about now, parenting skills, how far to go, when we've crossed the line. We'll talk about that on a future program. Dr. Hedberg, thank you for joining us on the program. And, of course, all that information is available at our website, thisweekinamerica.us. You can link on directly to his website, which is authorallanhedberg.com, and get information on the book. Look forward to having you back. Thank you.
Thank you. Nice to be with you and good interaction. Thank you.
Thank you. You're listening to This Week in America, website thisweekinamerica.us.